Welcome to the Maternity Mentor. Today we will be talking about what you can expect to happen when your healthcare provider wants to induce your labor. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Your healthcare provider may have just told you that you need an induction. Labor induction, or inducing labor, is just a technical term for starting labor, including contractions, before it starts naturally or on its own. Let's explore what you need to know before your labor induction. As you receive prenatal care, your healthcare provider assesses both your health and the health of your baby. As your pregnancy progresses, your provider may determine that an induction of labor is necessary for you and the baby. There are many reasons why your healthcare provider may choose an induction, including your due date has passed, chorioamnionitis, which is an infection inside the uterus, oligohydramnios or low amniotic fluid, leaking amniotic fluid, gestational diabetes, gestational hypertension, small for gestational age or SGA baby caused by the baby growing too slowly, placental issues like partial abruption, you're having a multiple birth like twins, your water broke but contractions haven't started, a history of short, fast natural labors, you live a far distance from the hospital or birthing center, or any other health concerns that make a controlled start to labor more favorable. As your pregnancy progresses, your healthcare provider will have discussions with you about when, why, and how your induction will take place if they determine this is the best course of action for you and your baby. During these discussions, they should explain all your induction options, their benefits and their risks, before you decide together as a team if and how to proceed with the labor induction. The choice of how to start a labor induction is based on a lot of different factors, with the reason for the induction being the most important consideration. Your healthcare provider will decide whether to attempt a manual induction or a medication induction, or sometimes both. There are three main types of manual inductions. The first and most common is an amniotomy, which is when your healthcare provider breaks your water. The provider will use a sterile tool called an amniotic hook. The provider will carefully guide it up through your vagina and cervix and then poke a small hole in the amniotic sac. This procedure can be uncomfortable, but for most women it will not be painful. Once that happens, it can start contractions if you're not already contracting, and it can make the contractions you are already having stronger. The next manual induction is called stripping the membranes. This is often performed in your healthcare provider's office. Stripping the membranes is where your healthcare provider inserts their gloved hand into your vagina and uses a finger to separate the amniotic sac from the uterine wall. Doing this releases prostaglandins, which can help ripen the cervix and make it ready for labor. Additionally, it may start contractions. Some providers may also stretch the cervix at the same time, where they insert two fingers into the cervix to try and manually open it a little. Both methods can be uncomfortable, so talk with your healthcare provider and have them explain the procedure so you know what to expect. The final manual induction method is the use of a balloon or catheter through the cervix. For this method to work, you need to be at least 1 centimeter dilated. Once inserted, the balloon is filled with sterile saline or sterile water. This balloon is heavy and then presses on the cervix using gravity to slowly drop through and dilate the cervix in the process. Some providers will also insert the catheter into the middle of the cervix and inflate the balloon there, stretching the cervix up to 3 centimeters. There are a couple medication options for inducing labor. The first is cervical ripening using prostaglandins. Prostaglandins help ripen your cervix, which means it makes it softer and more open, readying it for labor. There are a few forms that can be used. The first medication is cervical gel placed in the vagina near the cervix. One disadvantage of this is that once the gel is placed, it cannot be removed and sometimes can trigger a very powerful labor that may need to be reduced with a different medication. The second medication is called Cervidil. Cervidil is a soft, flat piece of cotton with a string attached to it that looks like a tampon. The medication is infused into the cotton, which is placed in the vagina near the cervix. It's usually left in place for 12 to 24 hours. If Cervidil triggers a powerful labor, it can be removed, which usually slows labor down a bit versus having to use a different medication to stop or slow labor. The third type is Cytotec or misoprostol. This is a pill that can either be placed vaginally in the cervix or swallowed. An advantage of Cytotec is that it can be swallowed, which is easier for mothers and reduces the risk of bacterial contamination inside the vagina. The disadvantage of Cytotec is that it can't be removed. All of these methods of induction require close monitoring in a healthcare setting such as a birth center or hospital to monitor the uterus and baby to ensure a safe induction. Additionally, continual insertion of hands and medication, even using sterile technique, increases the risk of bacteria being introduced into the vagina, which can lead to a bacterial infection of the uterus. Finally, the use of prostaglandins can be extremely beneficial and effective, but runs the risk of inducing a powerful labor that may not be tolerated by the baby and may require the use of additional medications to slow things down. The other medication induction commonly utilized is the use of Pitocin. Pitocin is a synthetic or man-made version of oxytocin, which we produce naturally in our bodies. Oxytocin is a powerful hormone that causes the uterus to contract in order to help the cervix dilate and then assist mothers' pushing efforts to deliver the baby. After birth, oxytocin continues to act on the uterus to contract it back down to reduce bleeding and the risk of hemorrhage. Pitocin is given to the mother through their IV site, which is an advantage because it can be stopped quickly if labor is speeding up too rapidly or if the baby is not tolerating it. The most important thing to remember is that your provider may decide to use more than one type of induction method to help move along your labor. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about how long an induction takes. Many women want to know how long does an induction take. Unfortunately, the answer is it depends. But it can be anywhere from a few hours to a few days. Part of the determination of how long an induction will take is how soft and open your cervix is to begin with. If your cervix is thick, long, and not very soft, your induction will probably take longer than someone who is soft and already partially dilated. However, that is not always the case, as everyone's body responds differently to an induction. Additionally, the induction method may make things faster or slower. For example, one woman may have Cervidil placed and she delivers in 8 hours. Another woman may have Cervidil placed and she delivers 4 days later. Both of these examples can be normal. Finally, the reason for the induction is also very important. If you are overdue but you and your baby are healthy, your healthcare provider may choose to go slower and longer, which can be better for both of you. However, for example, if you're developing an infection or your water has broken, your provider may choose a more aggressive, quicker approach in order to deliver the baby sooner. Again, both are normal. Ultimately, the message is it depends on the circumstances surrounding your induction, and a conversation with your healthcare provider should answer this question for you. In some cases, if an induction fails to ripen your cervix, your provider may even send you home and ask you to come back in a day or two to try again, as long as you and the baby are doing well. Most inductions go effortlessly without any problems. However, there are some risks of having an induction. These risks include an increased risk of postpartum depression, stronger, more painful contractions requiring pain medication that was not originally part of the birth plan, the uterus producing more frequent contractions, which causes problems with the umbilical cord or changes in the heart rate, which are not good for the baby, infection in baby or mother, especially a uterine infection, it might not work, bleeding after delivery, uterine rupture, an increased risk of needing a cesarean section, especially for first-time mothers, and possibly fetal death. Given the risks involved, your healthcare provider will monitor you and the baby very closely. The baby will be monitored using electronic fetal monitoring, which tracks the baby's heart rate and lets providers know how well your baby is doing in comparison with the contractions. Make sure you have discussed the risks with your healthcare provider prior to starting any labor induction. However, just remember, sometimes the risk of not inducing labor is greater than inducing labor, which is why your healthcare provider is suggesting it. There are some women that are not eligible for a labor induction. In these cases, if natural labor is approved but hasn't started, your provider may opt for a C-section. Additionally, there may be medical reasons why your healthcare provider will opt for a cesarean section no matter what. These reasons can include your baby is in distress requiring immediate delivery, your baby is breech, which means the head is up and the bottom of the baby is down, or your baby is lying sideways, your pelvis is too small to deliver the baby vaginally, you are attempting a vaginal birth after previously having a cesarean section, your placenta is blocking the cervix, also called a placenta previa, you're having an outbreak of genital herpes, you're having multiples like twins, or your baby's cord falls into the vagina ahead of the baby's head. First, make sure to write down any questions you have so that if your healthcare provider recommends the induction, you remember what you want to know. It's okay to ask questions, and you're allowed to ask questions, so do it. Make sure you have reasonable expectations. When labor needs to be induced, we are sometimes working against nature. This means things may not go according to the plan you had in your mind. Remember, the goal at the end of this is a healthy mom and a healthy baby. Keep an open mind to this new birth process. Every birth is different, but can still be rewarding and wonderful even if it's not exactly as you imagined it. Make sure you keep in mind that this can be a long process, so prepare ahead of time for childcare and pet care in case you're in the hospital for a few days. Pack lots of snacks and entertainment to keep you occupied. Staring at the clock can make an induction unbearable and may actually lead to worse outcomes. Before you leave for your birth location, eat a great meal at home. Once the induction starts, you will most likely not be able to eat anymore. Additionally, try and poop at home. It's very uncomfortable to become constipated in the birth location, and many women are not able to go due to being in a strange place under strange circumstances. So try and go in the comfort of your own home. Remember that induced labor is not natural labor, so it can be more painful. Try to investigate pain control options before your induction starts so you have a backup plan of what you may want to use if pain relief is required. Being in pain is not an ideal time to try and learn which pain control option may be right for you. Finally, be prepared to send your partner home if things are progressing slowly. This may be beneficial to both you and your partner, as the fresh air for your partner can leave them refreshed and ready to be more supportive for you. Additionally, the alone time may also recharge your battery so that both you and your partner are ready to greet your baby together and happy. Labor induction can be quite exciting because it means you're about to meet your baby. I hope this has explained why an induction might be needed and what to expect during your labor induction. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.